When was the last time you visited a dentist? A few weeks? A few months? Well, for Leonard KNOTT, it's been 20 years.
Good morning, Lynn. You ready?
After receiving a free upper plate at a dental school, KNOTT says he never went back.
So they yanked it out and gave me a partial upstairs, and then I never worried about it for 20 years. And I'll get into the drugs and the booze and everything. 8 years ago, I just quit everything. And the pain started coming back. It wasn't until like 2-3 weeks ago. It's like, oh, I can't stand it anymore. Like I gotta eat, I gotta sleep, you know. And I had to do something.
The bone is in good shape.
Today, he's getting a root canal. But in the past, due to his income, KNOTT says he simply couldn't afford a regular dentist. That is, until he found this place. Located in Toronto, Ontario, Evangal Hall Mission is an outreach of the Presbyterian Church of Canada. It's been serving the poor for over 90 years. Recently, the mission began offering free dental services to homeless and low-income people. Joseph Taylor is executive director.
So many people would come with obvious dental trouble, and really in crisis. I mean, you know, it's clear that they either were having a long-term dental cavity or an abscess that wasn't even being treated. The only option the vast majority of them had was to go to a free dental clinic and have their teeth pulled.
And for Taylor, that simply wasn't good enough. Realizing they had the space, Evangel Hall Mission decided to turn an area downstairs into a dental office.
We originally had thought of it as being a youth program area, and it didn't work out so well in this part of the building. We have the youth program relocated, and so that space was there, and we just made a decision, basically in faith, to go forward and provide this. And you know, the Lord has blessed us with the things that we've needed.
And once they stepped out in faith, he says, things just fell into place.
We did have to renovate the whole space, so we incurred a considerable cost for renovating the space, but the equipment, we just searched for good used equipment, and it was donated. And then I was quite impressed with actually how complicated it is even to install a dental chair. So there's specially trained technicians, and there was a technician. He came many times, and he donated all of his time. It was all free labor. So. There's been a lot of people coming forward because they realize this is such a need.
And one of the people who came forward was Dr. Tom VARDEN.
Can you turn to me a bit?
VARDEN has a private practice, but volunteers twice a month at Evangel, hoping to put a smile on his patients' faces.
It's a way to give something back. I have an amazing life, a great practice, a good family, and there's more to life than money, and you can help people that need help.
So what can a patient expect when they sit in the chair?
Typically, the first visit, myself or the other dentists that volunteer here or the hygienist will do a quick assessment and make a little treatment plan of what they need. If they're having a broken tooth, we do extractions. If they're cracked a filling, we'll do fillings. The hygienist will do cleaning, scalings.
And while he admits he's not an expert on the prices, he says those simple procedures can cost a pretty penny at a regular dentist.
Extractions can go as little as $90 to as high as a couple hundred if it's complicated. Cleanings can run in the neighborhood of $100 to $200.
Bad dental hygiene can also affect your health, VARDEN says.
Periodontal disease, gum disease, the mouth is loaded with bacteria, it gets in your bloodstream, it can affect your immune system.
And that's why free access to dental care among low-income families and the homeless is so important, says Joseph Taylor. But often it's overlooked because coverage is expected if you work, but that's often not the case for part-time or low-wage workers.
So many of us just take for granted the good things and the blessings that we've received all of our life, and that somehow that this is sort of my entitlement. I've always been lucky enough to work for an employer that provided a plan that gave me dental benefits. And I've needed a lot of work done myself, and I don't know where I would be without the dental plan, because going to a dentist is very expensive. It's way beyond what most people, especially in lower income, can afford. Okay, RC.
The clinic isn't open to just anyone. There are some ground rules to being a patient.
Most of the people are on welfare, or even a lot of the people that come to our drop-in don't even have any income. So there's an interview process that happens. We need to take your basic statistics and information from you, and then we will schedule, or our SEMA, our dental technician, will schedule a time when we have one of the volunteer dentists coming in.
Heather Riley is another patient who's eligible for free dental care at Evangel, and says in the past, being unable to afford a dentist has affected her nutrition and self-esteem.
It's a matter of, if your mouth is really messed up, you can't eat properly. You can't eat things that are good for you, like fruit, vegetables, anything like that. You need to be able to chew. And it's also a matter of self-esteem. If you've got snaggle teeth, you smile less, I know from experience. So if you can come and get some of those kinds of things taken care of, it's another little boost to your self-esteem.
And finding a job, says Riley, is next to impossible with bad teeth.
Well, it makes a difference. Unfortunately, people get first impressions from the way you look. If you have gaping teeth or black teeth or things missing, you're not as confident, which affects your ability to get work. And people, I think, are a little judgmental sometimes about it, that maybe you're not looking after yourself as well as you could.
And while the dental ministry is a huge success with people like Leonard Knott and Heather Riley, finding dentists like Dr. Varden who are willing to volunteer has proved to be a challenge, says Joseph Taylor.
We are really in need. There's just such a need for dentists. We could have a dentist in this office. We have the 2 offices available suites. We could have it in there 5 days a week and still not being able to reach all the people who really desperately need this kind of help.
Although there are challenges, by helping some of the city's neediest people, he says his faith is stronger.
When you're in the right time, in the right place, and this is something that is meant to be, that there's a sense that the Lord wants this to happen. It's funny, people come forward, things come forward, it all happens, and you don't necessarily know how all that is happening, but there's some greater plan that's being worked out.
And while Evangel is doing all it can to help those in need, Taylor says they can't do it all. His hope is that eventually free dental care for low-income and homeless people will be offered across Canada.
I know of people that have died as a result of dental problems. I think there has to be somebody who's willing to say, this is not right, and I'm just not willing to accept this. And I really do believe that as a society that has a large, enormous amount of wealth available, we should be able to provide sort of basic care for everyone.
To find out more about Evangal Hall Mission's dental program and how you can help, visit crossroads.ca and click on Guest Information. In Toronto, Ontario, I'm Bridget Antwi for 100 Huntley Street.